hepatitis. The liver is very important because we store certain elements, excrete others, and sensitize other elements. Viral hepatitis historically was called infectious causes viral hepatitis A, or transmitted through the serum viral hepatitis B and D, and non-A, non-B. Now become hepatitis E, enterically transmitted, hepatitis C, parenterally transmitted through the blood. The types of viral hepatitis. Viral hepatitis A, B, C, D, E. What is the source of virus? Enterically transmitted through the feces viral hepatitis A, viral hepatitis E, viral hepatitis B and C and D, all through the blood and blood-derived body fluids. The route of transmission is fecal-oral in viral hepatitis A and E, and it could be through a mucosa or cutaneous, or through the blood transfusion in B, C, and D. Chronic infection present in viral hepatitis B, C, and D, but not in viral hepatitis A or E. Prevention can be done by immunization in viral hepatitis A and viral hepatitis B. Till now, there is no immunization for viral hepatitis C. But the most important for it is healthy behavior, like not using others instruments which can deal with body fluids and blood. يعني ما ينفعش الواحد يستخدم فرشة سنان حد تاني، ما ينفعش المقص بتاع حد تاني، ما ينفعش مكنة الحلاقة بتاعت حد تاني، and etc. This is the hepatitis A virus, and it is present in our country. Egypt is one of the countries which has a high prevalence of hepatitis A virus infection. It is spread in the feces of people with hepatitis A, and is usually spread by close personal contact and by eating contaminated food or drinking water. عشان كده دايما بنقول الأطفال ما ينفعش ناكل الأكل اللي من بره اللي هو معرض للتلوث. لازم الأكل يكون أكل في البيت، وكمان أكل مستوي أو مطبوخ كويس ومش معرض للتلوث. ده مهم جدا. فبالذات في الصيف، في الوقت اللي الأطفال بياكلوا الحاجات اللي ممكن تبقى من بره واكسبوزد، دي ممكن هي سبب رئيسي للهيباتيتس A فيروس انفكشن سبريد. موسكيتو and flies، قصدي الفلايز اللي هي الدبان، الحتت الاكسبوز للدبان والحتت الاكسبوز اللي فيها قمامة، ده هيبقى more common ان يجيلهم هيباتيتس A فيروس انفكشن. هي هتقع على المكان اللي فيه السيوج ديسبوزل، او الاماكن اللي فيها قمامة، او الاماكن اللي فيها تلوث، وتروح تاخدها للاماكن اللي هي فيها الاكل وتسبب سبريد للانفكشن. كمان عدم غسيل الايدي بطريقة كويسة قبل تحضير الطعام وقبل الاكل من احد الاسباب اللي بتسبريد الانفكشن. فالهيلثي behavior is very important. هو الهيباتيتس ايه بيحصل ايه؟ ان احنا لما بناكل اكل ملوث ingestion، هيحصل replication في الجي اي تي، هيبقى transported لليفر which is the major site for replication، وبعدين يطلع من الليفر على البايل، then transported to intestine، then shed in the feces، يطلع بعد كده في الفيسز ويكرر من الفيسز transported again to another person by the flies, by the contaminated hands and etc. Child presenting with a picture of acute hepatitis, major symptoms what? Jaundice، يجي فجأة انه عنده صفرة associated with easy fatigability وعنده احساس بالارهاق، maybe abdominal pain and diarrhea، loss of appetite, nausea and vomiting, fever and dark colored urine. So a child with acute jaundice, you should very importantly that you should see and detect in this principal symptoms jaundice and dark colored urine with easy fatigability, with diarrhea, with loss of appetite. You should do liver function test. Key points you should remember: a case of acute hepatitis may be caused by virus, may be caused by toxin, or may be the first manifestation of chronic liver disease. Viral hepatitis A is self-limiting, but still there is a percentage of very rare deaths from acute liver failure secondary to acute viral hepatitis A. Okay. No rule to give any vitamins. This child should not go to the school, should be kept at home, and this child should care about the personal hygiene, care about washing hands, and then he move on as soon the patient feels that he is fit to do so. There is no need to keep the child in bed, and when jaundice clear, he is able to, and he can as well eat any type of food, no restriction to the proteins, no restriction to any element. Very important that there is a raised serum alanine transferase. ALT is the best indicator of acute hepatic injury, but does not reflect the severity. It doesn't mean when we have a very high ALT, this is a severe acute viral hepatitis A. No. Values for bilirubin are and international normalized ratio INR are required to detect the severity. When the bilirubin is very high, when there is tendency to coagulopathy or a raised INR or prothrombin time, this is an indication that this child may go to liver cell failure. It is endemic in Egypt. That's why hepatitis A vaccine is recommended to take in Egypt. And incubation period of hepatitis A around 30 days, range from 2 weeks to 50 days. Jaundice may appear less in the young children, more in the older children. Complications: fulminant hepatitis, cholestatic hepatitis can occur, relapsing hepatitis but no chronic sequelae. These are the symptoms. When we have hepatitis A infection, we have the fecal with the appearance before the appearance of jaundice, and at early in the disease their fecal transmission of hepatitis A. Then the fecal excretion of hepatitis A virus decrease later on. It is diagnosed by detecting antibodies to hepatitis A virus, which is called anti-hepatitis A virus immunoglobulin M. This is the method of detection: anti-hepatitis A virus immunoglobulin M. What is the most common advice to pediatrician by the pediatrician to the mom in case of acute viral hepatitis? To give a diet rich in carbohydrates and deficient fats. This is wrong. ما ينفعش ندي سكريات وما في بروتين. This is false. You should give the child the normal diet as he wants, but in a small frequent meals, and any diet the child prefers. You can give proteins, carbohydrates, and you can give fats as well. Vitamins and minerals unchanged, but do not give iron supplementation. Lifestyle, which is the healthy behavior: washing clothes with hot water, washing your hands before and after using toilet, before eating, heating any contaminated articles, using household bleach. الكلور من الحاجات اللي بتنظف وتديسانفكت كل السيرفيسز. keeping any eating and cooking utensils or dishes used by someone infected separate from the others. يبقى ياكل في طبقه وياكل بمعلقته وسكينته وشوكته. This is very important. And the prevention is by hepatitis A vaccine, which prevent hepatitis A, effective in around 95%. لو قلت لك ايه نوعه, it is inactivated vaccine. okay, وبيتاخد at the age after the age of 1 year. It is given by intramuscular injection, the way of prevention. So hepatitis A virus is the most common important diagnostic test in acute viral hepatitis A. If it is positive, so this is hepatitis A. If it is negative, you should proceed in doing other viral hepatitis markers rather than hepatitis E. Thank you very much. شكرا.